182,000 women will be diagnosed with breast cancer this year, and it will claim 40,000 lives. Dr. Dara Richardson-Heron is with the Susan G. Komen Foundation and is a breast cancer survivor. Good morning.
Good morning.
You found out 11 years ago, 1 month after getting married, that you had breast cancer.
I did. I have to tell you, it was very devastating for me.
What did you do?
Well, the first thing I did was what most people do is you act like it's not there. I was under the age of 40, and it's very unusual for women under the age of 40 typically to get breast cancer, certainly 11 years ago. And I have a family history of breast cancer. My mom had breast cancer, and being a physician, I knew I had to be evaluated.
Your story sounds similar to that of Christina Applegate,
That's right.
the actress who
That's
had
right.
a double mastectomy. Her mother also had breast cancer. If you're a young woman and you have a family history of it, what should you do?
Well, first of all, it's very important to be aware of your breasts. We at Susan G. Komen make it very clear that you should be aware of your breast. And what that means is touch your breast, know what they feel like, know what's abnormal. And also, you should talk to your family about your family history of breast cancer. Back 26 years ago, before our organization was founded, many people didn't talk about breast cancer, so you didn't know if your mother or your sister or another close relative had breast cancer. You should also talk to your doctor about the kind of screening test that would be appropriate for you.
Meaning MRI versus mammogram?
That's right.
Is one better for certain types of people over the other? Should you get both?
Well, actually, right now, mammogram is the gold standard of care for people who are 40 and over and have an average risk of breast cancer. However, when you talk about people who are at higher risk, typically you're thinking about people who have, either the BRCA1 and 2 mutations, or people who have a high family risk. They may need additional tests, such as an MRI. But really, it's very important to talk to your doctor about the tests that are best for you.
Are there things that women can do, incorporate into their lifestyle to reduce the risk of getting breast cancer?
Absolutely. One of the things that's important is to maintain a healthy weight. Obesity leads to an increase in estrogen in the body, and that's been thought to increase the risk of developing breast cancer. The other thing that it's very important for people to do is to make sure that you add exercise to your routine. I'm kind of speaking to myself on this one, but exercise to your routine, because exercise helps you maintain your weight as well. And also avoiding alcohol.
Altogether?
Well, there have been studies that have shown that increased alcohol results in an increased risk of breast cancer. And it's important to know that a risk factor is just that. It increases your risk, does not necessarily mean that you will develop breast cancer.
Dr. Dara Richardson-Heron, thank you so much.
Thank you for your time.
You're welcome.